All right, thanks for the invitation to be here. It's been a great session so far. So do we have effective stewardship in the veterinary sector in Canada? My answer is absolutely. Things are unfolding exactly as they should. I think we need to set some context that in the veterinary sector we started in the resistance area about 20 years ago essentially from scratch. That resistance was not a big issue in the veterinary sector. It's still not really a major problem in animal health. It came on the scene because of the problems in human medicine that we've heard about. Up till then, the concerns about human safety with respect to antimicrobials was all about residues in food, something that most of you probably are not aware of. And so we had to sort of build the system from scratch. We've heard about the complexity of AMR. Antimicrobial stewardship in animal health is indeed highly complex, and a lot of it has to do with those multiple species factors that you've talked about. Also, the many players that are involved in the food chain bring about a high degree of complexity. I think we need to think about the context of finances in this sector. In the real world of the veterinary business, everything is fee for service, essentially. In veterinary practice, veterinarians have to collect their fees largely from their clients, their producers, and so there has to be a cost effectiveness there, and the costs of antimicrobial stewardship are essentially borne by the clients, that is the animal owners. Farming is also a business, and so things have to be done in a cost-effective way and be responsive to market forces. That's what drives change to a large extent in this sector. We have to think about that with antimicrobial stewardship. So one indicator of progress is what's been accomplished. Rebecca made mention of this report that was made to Health Canada several years ago. John and I both worked on it, and as many others. It was multidisciplinary, multi-stakeholders. We had many of the recommendations that were present in the WHO recommendations from several years before. I'm happy. I went through it again the other day. It's been many years since I've done that. Of the 38 recommendations that were made, I think 34 have been implemented, which I think is a major achievement, and these covered the broad spectrum of stewardship, surveillance, infection control, research, and innovation. And among those recommendations were some big issues that were parked on Health Canada's plate, and that had to do with regulation of veterinary drugs. And I'm happy to say that there's been some major accomplishments here that have a big impact on stewardship, moving all the growth promotion claims off the table. So getting rid of growth promoters has been a big deal. Moving antibiotics from not available over the counter, so having them available only under veterinary prescription is a big deal. Those two factors together will have major implications to stewardship. They're also closing some irritants, the so-called own-use importation API loopholes, which may be obscure to many of you, but we can explain it in great detail. And also improving antimicrobial use monitoring through a regulated means has been a big win. And all of these changes have done a lot to bring us into line with our major trading partners in North America, Europe, and Asia and elsewhere, which in this business, being economically driven, business driven, is a major accomplishment. We've also seen great buy-in from a lot of organizations which are slow to get mobilized, but now are highly engaged. The Canadian Veterinary Medical Association has this now as one of their top priorities to improve stewardship. They realize the big responsibilities that complete oversight of antimicrobial use entails. The Canadian veterinary registrars, because veterinary medicine is regulated at the provincial level, they've been working hard to try to harmonize this across the country and try to come to grips with improving veterinary oversight in this issue. CVMA is doing further work to update and improve its prudent use and stewardship guidelines, which is a major undertaking because of the multiple species factor. Specialty veterinary groups that are involved in species-specific practice are engaged, as are many provincial organizations which have a role in stewardship. The private sector and industry have also come to the table in a significant way. There's been heavy engagement by major farm groups that are responsible for the various commodities with this issue. Most of them are very active in antimicrobial stewardship. An excellent example, I think, is the leadership shown by the Canadian poultry industry in banning the prophylactic use of Category 1 drugs. These are the drugs critically important to human medicine. The example of ceftiofur, ceftriaxone that Rebecca showed you this morning, they no longer permit this in the industry for prophylactic use. We've seen major improvements in what you would call infection control, what we in the veterinary sector call biosecurity, health management, to improve animal health, reduce the need for antimicrobial use, and to curtail the flow of pathogens in the animal environment where hygiene is a real problem. And we have to acknowledge the major efforts that are made by CFIA and the major food processing industries in their efforts to control pathogen spread through the food chain. And so that does a lot to curtail the flow of foodborne pathogens that are resistant from animals through the food chain to people. Again, market forces are driving a lot of the changes in use in antibiotics in agriculture. Witness the marketing campaigns by A&W, McDonald's, and other flagship companies on their efforts to reduce antibiotic use. Finally, I'd just like to say that in the global context of things, I think Canadians and Canada in particular is really doing quite well. Our efforts are exceeded only by those stellar performances by the Nordic countries and Northern European countries in terms of antimicrobial stewardship in the veterinary sector. They are really advanced. It makes everybody else look good. But with respect to the rest of the pack, I think we're quite active. And I think there are contextual reasons why things are so much different here that have to do with the combination of factors that drove these Northern European countries to take more aggressive action. That just doesn't exist in Canada. We don't have the same appetite for top-down interventions in this country, directives to do this and that. So we have to work with what we've got. Canadians are improving stewardship through their contributions to major organizations internationally, as we've heard before. And I think we also have to realize that the level of intellectual expertise that exists across this country in antimicrobial stewardship in the veterinary sector is vastly increased over the last few years, as recognized by the tremendous amount of research and education that's gone on. So the answer is that I think this clearly shows that we do have effective stewardship in the veterinary sector in Canada. Thank you very much.